today we decided we'll talk about relationships. And relationships are so critical, beside diet and movement and sleep, which we have done, relationship and is the key for keeping us healthy. And what we mean by that is stress. How do you look at stress? What is happiness? What is sad? And how all that come together. And Sushmaji, it's no surprise, there is the science of it,
Yes.
which is what I've been practicing for 40 years.
Right.
And there is the ancient wisdom of Indus Valley Vedic yogic science,
Right.
which talks about the body connection to the mind
Right.
and mind connection to intellect.
Right.
So I think it's very important that we, as part of our health, clearly put relationships as part of those 4 lifestyle which makes you healthy. So that's what we are talking about.
So when you're talking about relationships, and you talk about emotions, there are a lot of things that come in emotions, right? All kinds of emotions, and this is all mental health that you're talking about.
Yeah,
Really.
essentially, it all depends. What is your attitude? It's you, your health, and the gap, and the gap is from within. So, what is your attitude?
Towards life.
Yeah, and how you see. Some people say life owes me something. Some people say I owe life. And interesting thing is that in yogic philosophy there is a great emphasis on a ill-defined entity called mind, which is different than brain
Yes.
and thought. So it's all about thought. So foundation of having relationship is thought.
Right.
Some person react to same thing very differently than other people.
And their reality is different from the other person's
Yeah.
reality.
So I think
Right.
in our episode we cannot give all the recipes. We'll try in our last episode. But what we're saying is that the relationships is a critical component to keep you healthy. And health promotion, illness prevention, and even disease management, your attitude towards it. Family, your relationship with family. How do you see when you see a problem? Some people say, I don't want to do it. Some people say, why not do it? So, negative versus positive attitude.
So every emotion has its positive and every emotion has its negative.
Yeah.
So if you're happy, somebody will be unhappy. If you are partying, somebody will be depressed and alone. If you're angry, somebody will be, totally opposite to that.
Yeah, absolutely. So I think the other thing is we need to differentiate between lifestyle related relationships and actual pathological diseases which bring mental illness. So we're not talking about that part, the
Right.
so-called psychoses.
Right.
What we're talking about is, generally speaking, what is your reaction and attitude to life? And with that, your relationships. And that is related to yogic science in terms of mind and meditation, for example.
So let's take each emotion separately then.
Okay.
Shall we?
Yeah, sure. Emotions are defined in textbooks as 8 different emotions: anger, calm, growth, love, all those emotions.
Yeah.
And there is a hierarchy.
Mm-hmm.
And I think rather than confusing with the individual emotions,
Right.
what we are saying today is that emotional health is as important to consider
Yes.
to be healthy, and it is a gap in your health.
Okay. Okay, I understand. So, in other words, that even if we are stressed or we are unhappy, we are not okay at work, we are not okay with our family, we are not okay with with our financial situation, or we are not okay with life itself, we've got to be better to be able to lead this life and live.
Yeah, so I think it's all depends is what your expectations are. If your
Yeah.
expectations are way beyond your capabilities. The other thing I want to introduce is a concept of different intelligences which affect this. So it's all about thinking and mind. So we have native intelligence, which is called IQ. Then we have uh, EQ, emotional intelligence.
Intelligence, okay.
And then we have SQ, spiritual or self intelligence. And what it talks about is native intelligence is the cognitive facility, your brain essentially. But emotional intelligence is how you relate to others. So, again, the point I want to make under stress and relationship is it's up to you how you control those relationships.
And how can one control relationships? How can one control stress or anger? Or so do you go to a yogic way of life?
Yeah, so I think again, in my mind, it's a best of East, best of the West, and science and art.
Okay.
And when we talk about relationships, East really has much more depth in understanding, and it is related to mind, and mind is related to thought, and thought is related to how you let things come. And this is where, in terms of yogic science, there are 8 limbs of Patanjali Rishi. First one is Yam, second one is Niyam, then Pranayam, and then Asanas. And the Yam and Niyam define who you are. They kind of rules by which you live, and what upsets you, what doesn't upset you, personal hygiene, personal awareness, truth, and cleanliness. All those things are tied in there, and that is really Eastern way of controlling. But the biggest gift of that is mind meditation. So dhyan and dharan, and eventually having a calmness of the mind. And I think that determines how you react to whatever is coming at you.
I want to bring a scenario for you so that you can explain it to people.
Yeah,
Okay?
and just so I don't lose
Yes.
thought, we'll come back to the biochemical basis
Of
of
course.
emotions.
Sure. Biochemical component of emotions. I want to talk about that. But I want to give you a scenario of a family that are here. They've got children and they are looking after with the current financial situation that is going in the world. How can they be so cognizant of the outer environment, inner turmoil, and how they're going to be bringing up their children? So what can they be doing so that they can live in a very harmony sort of a way?
Yeah, which is very difficult. It's very easy for someone to say, do this or don't do this, but it's very hard to put yourself in one's shoes, So these are just general guidelines, and there is no blame in here.
No.
And there is no judgment.
Right.
But it's just that you see there have been a lot of books written about happiness index of people and the countries. And some of the poorest countries are the happiest countries.
That's right.
The Bhutan
Yes.
has one of the highest happiness index.
That's right.
And I think it's a state of mind what you expect.
Yes.
If you expect 100 points and you get 99, you're unhappy.
Yes.
But if you only expected 80
Yes.
and you get 85,
Yes.
you are
Ecstatic.
happy. Yeah, and I think that's the practical thing I want to kind of leave in people's mind is that always think that you're going to do say 60%,
Yes.
but do 80%,
Yes.
and that's a positive way of getting thinking you have achieved more than what you set out to do.
You want to cheat your own self. In a
Yeah,
way.
so but I think basically all those things you were talking about come from expectations. If
That's
your
right.
expectations are that you're always going to get A plus, you're very unhappy with A minus or A.
Yes.
But if your expectations are that I'm going to do my best, so that we cannot compromise. You always have to give your best.
Yes.
But say A is okay.
Yes.
But then when you get A plus, you're
Yeah.
happy. So that idea of general idea of emotional stress.
In other words, you're trying to ask us all to become Buddhist in a way. So no attachment. No attachment, and if you don't have any attachment to anything, you're going to be the happiest person in the world.
Yeah, which is hard. And I mean, we all live a life, so we have to have attachments, we have to have loved ones.
Yes.
But it's just the degree when things don't go your way or they don't go the way you thought they should go, how you react. And I think that's the key. And that comes from meditation. And meditation fundamentally is a tool, which we'll talk about in our last episode of tools. How do you control the mind, the calming of the mind and thought? So yoga, chitta, vritti, nirodha. So vritti is thought process. So you have good thoughts, you have bad thoughts, and you have gibberish thoughts. And then you have dreams, and then you have memory. And those 5 things control what your thought becomes.
Right.
And I think what I'm saying is that to minimize the stress related to relationships and all that, we should focus more on good thoughts, not worry about the bad thoughts. And try not to be gibberish.
But how can you take bad thoughts out of your mind?
My goodness, Sushma, if I knew this, I should have a happiness pill. I think it's practice.
Yeah.
Practice. And also some comes from experience, some comes from support systems, social determinants, and some people are more lucky than others. And I think we just have to work with it, but never compromise what you believe in.
So, Dr. Saab, apart from physical health, our emotional health is as important as our physical health is.
Yeah. So I think in terms of emotional health, we're talking about the role of mind so far. But physical body has very beautifully understood biochemistry. And biochemistry is based on hormones. And I think what you're trying to do is minimize high emotional hormones and reduce stabilizing hormones.
Okay.
So the big hormone which plays a huge role in it is cortisol.
Right.
And people have heard about it. And I think what you try to do is try to stay calm, and all those things which increase your cortisol. And I think there are calming hormones like serotonin in the brain, and then there are dopamine, and then there are other amino acids, and that biochemistry of stress is well understood. And I think interesting thing is that if you follow meditative pathways, most of those hormones remain in balance. And so it is taking a Eastern philosophical thought and proven by modern science.
Now, I also understand that you have written a book.
Yeah.
And it is available right now.
Yeah, it's just came out today, as a matter of fact.
Isn't that fantastic? So, what does this book talk about? Does it have anything to do with whatever we've
Yeah,
been talking?
everything I'm doing is interrelated. So, a colleague of mine in India, like we have Canada India Network Society,
Yes.
so we have projects in India, and I was so lucky to meet this person in India who is an engineer by training, but has given that up
Yeah.
and wants to take his message to general public
Yeah.
about good health.
Right.
So he wrote a book which was written by an engineer perspective,
Yes.
and man is brilliant because he has written a biochemical book of good health, having never gone to medical school. So we started to talk,
Yes.
and we say, well, why don't we combine your talent of writing
Yes.
and my passion for bringing this out?
Yes.
So out came You, Your Health, and the Gap.
Yes.
So what we have done is what we've been talking on podcast and everything.
Yes.
Now we have gone deeper and have starting to produce these monographs.
So we've got image of this on our screen, and people can get it from Amazon,
Yeah, it's a
and it'll help them with this podcast as well.
Gita, Your Health, and my co-author is Dheeraj Garg and myself, and it's available on Amazon. I didn't know we will be talking about it. There is a link,
Yes,
Canadian Amazon,
we've got that.
and it's relatively priced very low. I think it's $15 or
Awesome.
$14 for
Fantastic.
a print book.
Yes.
And Kindle is like $2 or $3, and but I'm going to give most of my whatever royalties I get to this
Yes.
50 Legacy South Asian Fund, which we have established.
Oh, at
So-
Royal Columbian Hospital.
so it's all good cause.
Good.
But the first book is of if you visualize it like a house,
Yes.
and house has a foundation,
Yes.
and then the pillars, and then the roof. So the foundation is based on best of the east, best of the west.
Right.
And what we are trying to do through foundation is our strong perspective that culture plays a huge role in your behavior. And if you're going to have behavior modification and lifestyle, it has to be tailor-made to precision culture. And that's what this book is. And we're talking about people who have yogic philosophy as something they at least understand.
Yes.
Every culture is different, and I
Yes.
think, but principle is applicable.
Of course.
So you could then apply that culture wherever you're coming from for self-determination. So this particular book is our interpretation of Bhagavad Gita, 18 chapters,
Right.
as seen through the eyes of an engineer and a doctor for your health.
Isn't that just beautiful? That culminates our 6th episode of this podcast.
Thank you. Yeah.
Thank you.